everybody, and thank you so much for making this part of your day. When Delanar and I were chatting not long ago, we thought, you know what? We do have a couple of new people on our boards, maybe provide an orientation. It's right, Delanar, say it correctly.
It's right? Okay, good.
It's right. Yeah, thank you. And then we thought, well, why not invite everybody? So anybody, even if you've been on the board for a while, might need a little refresher, or, we all have things that we remember and we get on information overload and can't remember everything. So we thought we'd provide it to everybody. And then, of course, this will be a collaboration as we talk about everything. It's informal, bring up questions. And if you have something to add, by all means, please do so, because we know you have great experience in these concepts and topics as well.
And to go along with that, some of you have not had this level of orientation. Mm-hmm. And there may be some things we did not include that you have questions about. We want you to feel at liberty to say, well, what about this? Yeah. Well, what about that? Because while it's only an hour and a half, we would like for it to be as all-encompassing as possible.
Absolutely. Very good. All right, so just before we get started, we outlined several topics we wanted to share, but does anybody have any burning questions? Is there anything that you've had a question about and just maybe you didn't have the opportunity to ask it? Is there something we need to discuss before we move forward? Okay, well, we'll get started. Again, let us know if questions arise.
Okay, so we're going to start by talking about the American Nurses Association and the relationship with KNA. Some of the other ways that ANA advances the nursing profession is by helping nurses reach the highest potential. The American Nurses Credentialing Center, or the ANCC, is a subsidiary of the American Nurses Association, and it's a certification body for the nurses, a nursing board certification. The Magnet Hospital and Continuing Education certifications are part of the ANCC program. And then we have the American Nurses Foundation, and it's not like a lot of other foundations. It really focuses on awarding research grants. And as you can see, they've awarded over 900 nursing research grants since 1955. And then last but not least, I would like to speak about the American Academy of Nurses, which is made up, it's an independent affiliate of the ANA, but it's made up of nursing leaders who symbolize and generate and disseminate nursing knowledge to contribute to health policy and practice for the benefit of the public and the nursing profession. And that was founded in 1973. One of the things I really like to talk about is what the ANA does on the Hill for us. They advocate for every nurse in the country every day on the Hill, both sides of the aisle. They are our congressional representatives, and they work on major legislation. They lobby on myriad of bills, but one that I would like to bring forward is the Nurse Reinvestment Act. And that legislation was focused on how do we address the nursing shortage. And so that legislation was passed to address the nursing shortage. Another major legislation supported is the reintroduction of the Safe Nursing Patient Care Act. And that's the bill that focuses on mandatory overtime as staffing tool. And what's so interesting about that in particular is now we have nurses who work 12-hour shifts, but they don't have to work 12-hour shifts as a way to manage staffing. It is not a requirement. And so it was addressing the Nursing Patient Care Act that allowed for using mandatory overtime as a staffing tool to go out of existence. Next, I'd like to talk a little bit about some of the foundational work that the ANA has done, especially with the Code of Ethics for Nursing. As many of you know, the Code of Ethics has social justice embedded inside of it. And in the near future, it is an expectation that the Code of Ethics will have another provision that specifically addresses the social justice needs. So there are 9 provisions within the Code of Ethics. And one of the things that the KNA has done through the Ethics Committee is to give the bookmarks that have all 9 provisions on it to nursing students on graduation. And I think that that's pretty pretty awesome. The other thing that I would like to talk about is our relationship with our affiliates program. We'll talk a little bit about the Kentucky Nurses Association, the Kentucky Nurses Foundation, the Kentucky Nurses Action Coalition, our relationship with student subscribers, the KBN and CANS. So that is a lot. So let's start with the foundation, and we're going to do more specific, but in general, I just want to say for the foundation, we raise money to give it away. And as most of you know, we just finished our Kentucky Nurses Foundation raffle where we raised $26,000 before we paid all of our bills. So at the end, it was about $13,000. And then the Kentucky Nurses Action Coalition has been primarily focused on workforce. Our affiliates program, we started about actually right around the time COVID came. We now have 22 affiliates, and will be having our next meeting on Monday, February the 6th. We have student subscribers, which we now call student members because they didn't like the subscriber name, so we changed it. And then, of course, we have over 800 student members. And as you well know, students are our future. And then our relationship with the KBN. I think we were talking about that a little bit before everybody got on. Our relationship with the KBN is so strong and so supportive. And we've worked very hard to support the KBN when they need support, just like they support the KNA when we need support. And then there's the Kentucky Association of Nursing Students, which is a totally different organization than the student members that belong to KNA, ANA. It is a totally separate organization. And for a lot of people, they are unaware of that. So the foundation is a 501c3. And when it comes to grants, when we need to have a 501c3, we utilize the KNF, and they do get some remuneration from allowing us to use the foundation for grants. And as I said, raise money to give it away. Research, education, scholarship are the main issues, and disaster relief. As you all know, we participated with disaster relief in Western Kentucky, as well as Eastern Kentucky, and we will continue. As communities need us, we will show up. We also manage the Nightingale Tribute from the Kentucky Nurses Foundation. We already spoke about research and scholarship, but want to speak briefly about the license plate, which we just recently found out will not be released until July. And we hope July is when it will be released. The important thing about the license plate is that anyone can purchase it, and $10 from the purchase goes to the foundation that they can use for research and scholarship. And then we have the Nurses Action Coalition. We just left their external advisory board meeting so that we could get here to talk with you all. But the Kentucky Nurses Action Coalition actually got started through the Robert Wood Johnson Foundation and the AARP, and looking at the campaign for nurses and working towards transformation of healthcare through nursing. So KNAC is doing well in terms of addressing workforce data and looking at how we can move forward. I mentioned the future of nursing, the workforce development. Three other things that they are highly focused on is prevention of nurse suicide. As you well know, members from the KNAC worked with the KNA to produce the prevention of nurse suicide video that is part of the mandatory education that is needs to be done by July 1st. The KBN mandatory education, the KNA did not make it mandatory. We did make a proposal to the KBN, and the KBN agreed with our proposal and said, this is a way that we can save lives. Then, of course, the prevention of workforce violence, workplace violence, and then the school nurse in every school all day, every day. One of the things that I mentioned at the board meeting just recently at the external advisory board is that one of the reasons that the KNAC became part of KNA is that we had a group of nurses who were working on workforce development, preventing nurse suicide, workforce violence, and school nurse in every school every day. And we had a group over in KNA doing the same thing. So we came together so that we could build on the foundations that we already had established and began to work together and pull things together so that we could work together and have more nurses going in the same direction because we were working on the same things. Okay, most of you all know that we have very strong mission, vision, and values. And these mission, vision, and values are not new. You know, we were established in 1906, and shortly after that, the KNA, which was the Association of Graduate Nurses at the beginning, and then registered nurses, and then on to the Kentucky Nurses Association. But the vision, mission, and core values were established during that time, and they remain current for us, except I'm going to show you when we get to values, we've added something to the diversity and inclusivity. So to be the voice of nurses and work for the health of Kentucky, and then advocating for engaging with and advancing the professional practice of nursing through leadership development. All nurses are leaders, evidence-based practice, and education, research, and membership growth, all things that we need in order for this organization to move forward. So when we look at the core values, I said that we added one thing to the core values, and we haven't put it on paper yet, but we work towards health policy. Through our actions, nurses will promote quality healthcare, strengthen health awareness, and direct healthy promotion, leading to improved health outcomes. Our core values, this is where we've made an addition, and we've done a very good job with this addition. We always had diversity and inclusivity. And I have to tell you, when I was considering whether I wanted to work for the Kentucky Nurses Association, it was these core values that made it that solidified my commitment to the KNA, that I wanted to be part of this organization, that diversity and inclusivity was important. Well, we've added social justice. So what we have now is we have justice, equity, diversity, and inclusivity. And as you well know, that's called JEDI. So we also have, as part of our core values, high ethical standards, lifelong learning, hence our CEs. You know, in the last 2 years, we presented over 8,000 hours of continuing education, accountability, and stewardship. Let's talk a little bit about how we're structured as an organization. You will see that membership is way up at the top, because if we don't have membership, we do not have the resources to get the things done that we said are our mission, vision, values, and core values. We just do not have the resources. So we have our president, of course, and then we have our board of directors, and we have on our executive committee, the board of directors, which includes secretary, treasurer, president, vice president, that group. And then, of course, we have our Kentucky Nurses Action Coalition and the KNF as well. And then there's me. And under me, you will see that all the staff, and I'm going to tell you a little bit more about them as we go forward. We have 11 chapters, 3 cabinets, and 7 committees. All of the cabinet members are elected. In terms of committees, we only have 2 committees where the members are elected, and that's Ethics and Human Rights and Nominations and Elections. And the other committees, those individuals are appointed by the board. We have, as I mentioned, we have 11 chapters, and wherever a nurse is working in the state of Kentucky, there is a chapter to support that nurse. And one of the most important things about those 11 chapters is they are the resources in the community to get the work done. So, a good example is when we had the disasters, we had chapters in those areas who said, KNA, we need some help. What can you do to help us? And KNA said, we're there for you. And we did. We provided, oh my goodness, we provided what we could for those communities in need.
All right, so I have some of the basics to talk about with board information. And again, this is review for the majority of you, but hopefully there'll be something that you can pick up. You know, obviously we have monthly meetings that we can get together and discuss the topics appropriate for the different boards. The monthly meetings for the KNA is the first Monday of each month from 10 to 12. The KNF Board of Trustees is the third Tuesday of each month from 11 to 12:30, and the KNAC Board is the second Thursday of each month from 10 to 11. So just kind of give you an outline of when those are. Some of those are not your committees or boards that you serve on. And then depending on your role within the board, you may be on additional meetings or additional committees as well. For example, Jody serving as vice president, he is also the chair of the bylaws, so he'll be involved with those. And then on the next slide, I talk about board liaisons. So I'll move in that when we get to the next one. On the importance of being at the meetings is that we encourage everybody to please attend as much as you possibly can. We know how busy each of you are, and we know life happens. But if at all possible, please attend whatever board meetings that you have, as well as committees or cabinets or, whatever it is that you're involved with, because there's so many different aspects of the KNA that you can be a participant in. But your perceptions, your experience you bring forward, the discussion, the input, the information is so very valuable. So hopefully you can attend all of your meetings that are scheduled. But the bylaws does outline that all board members must attend at least 75% of the meetings per their role. So again, we do understand life happens, and if it does and you cannot make a meeting, we understand. Just please make us aware so we know that you will not be able to make it. Now, the agendas, every meeting has a full agenda and, full of information to discuss throughout the meeting time frame. Now, depending on which meeting it is, there may be information in the portal, and particularly for KNF and the KNA board meetings, as well as the financial finance committee. There are several documents that will be put into the portal beforehand, and we need everybody to review those ahead of time so that you have the information for us to discuss and, move our meetings into governance and be able to discuss those topics and make decisions. So you're provided with a password for that. And then it's a variety of documents that are very dependent on the topics on the agenda for that particular meeting. And there'll also be reports to review. And then again, depending on your role, you may be asked to complete a report. So if you are the board liaison for a committee, you will asked to complete a report, or if you're the chair of a committee or cabinet, to submit a report to go into the portal so that we can review those prior to the meeting. And that way, reporting is not taking the majority of our board meetings. We will have time for that. We can certainly ask if there's anything that needs to be highlighted from the report by that person who created the report. But then also everybody that's in attendance can certainly ask questions and will bring up information for discussion. And that way we can move from reports taking up the majority of the time of our meeting to governance taking up the majority of our meeting. Those reports, if you do complete one, they are due on the 20th of each month, because there are several documents, and that way everybody can have time to review those prior to the meeting. Pretty much covers that. And that way we have time for questions and so forth. Next is moment permission. We always put that at the top of the agenda, and it really sets the tone for our meetings. It's where we can take a minute to share something that's great about nursing, motivate and inspire each other, remind us of our purpose and why we're here and why we serve the KNA and 90,000 nurses in Kentucky. So, examples are, share great work of a nurse or a group of nurses, share a poem, a video, a song. If you're leading a meeting, you can certainly do the moment permission, or you can ask for a volunteer for the moment permission. Generally, somebody has something to say that they can share and, promote nursing leadership. If not, if Delanor's there, she always has something to share. So you can always count on her, which is a nice reprieve. It's because she's so involved with the KNA, obviously, and she sees all of the great work, and, she can share the great moments. So that's wonderful. Another way, if you are leading the committee or the cabinet, that is a good way to share, where all of the members will provide information during a moment permission, because some people don't feel comfortable on the spot, or they just may not be able to think of something quickly, is if you ask for volunteers ahead of time. So you can ask for, the next several months, who would like to present in February, who would like to do the moment in March. And that way those people can plan ahead and maybe find that video or a poem or something they'd like to share. So that's another great way. That's helpful as well. But either way works. Main thing is that we get our meeting started on a good foot. Professional development. absolutely an aspect of the KNA. And at the KNA board meetings, we strive to provide governance professional development at each meeting. We have shared great articles and information and, board resources. But most recently, something that we're starting is a book review. And it's on an excellent book that Delanora found on From Silence to Voice. And I'm really excited about that because this Friday at our board meeting, we are going to discuss the introduction and the first chapter. And there's so much great information in just that little bit of the book. We could truly take the full 2 hours. It's going to be hard to take it down to 15 minutes, but definitely continuing with resources and how we can use them to promote the great work of the KNA. And also you have, obviously we're doing this at the KNA board meeting, but there are so many professional development offerings throughout the entire year that you can participate in that cannot help you grow professionally. So we hope that you participate in as many of them as you possibly can. Minutes, those of course are typed and reported for us to review. When you review them, if you see anything that needs updated, you can let us know and we'll absolutely get those fixed. But otherwise we discuss them at the meetings and then we vote and, approve the minutes that they are appropriate reflection of our previous meetings. So those will always be either put in the portal or sent out for review, Board positions, Delanora mentioned some of them just a little bit ago. For the KNA board specifically, there is a president-elect, or immediate past president, depending on where we are in that cycle. So right now we have immediate past president with Donna. She'll serve until October. And then in August, we will be voting in a new president-elect that will take over the end of October, first part of November, and will serve as president-elect for a year. And then the cycle continues. We have vice president, secretary, and treasurer. There's 4 directors at large. We have a CANS consultant, and I know Delanora talked about the CANS program. So this consultant kind of leads and collaborates with the CANS group. And then we have a chapter liaison who serves as a resource and support for our chapter chairs. We have Kelly Jenkins from the KBN on our board, as well as the chairs from the Policy, Procedures, and Resolutions Committee, the GA Cabinet, Professional Nursing and Advocacy Cabinet, as well as the president of KNAC and the chair of KNF. So quite a few members on the KNA board. And when you're thinking about different members on whether it be a different board or committee, you have the great directory that's been sent to everybody. And it has the contact information for the KNA staff, the KNA board, KNF, and KNAC boards, our affiliates, the legislative and leadership academy fellows, our chapter leadership teams, committees, the cabinets, as well as our KNA team leaders. So a fountain of information there as far as contacts with our very active KNA members.
I would like to add 2 more things on the board positions because a lot of people are not aware of the CANS consultant is something that was in our bylaws initially. Mm-hmm. But since the KNA doesn't have a formalized relationship with CANS, we started growing student members and they became members of KNA and ANA. So our CANS consultant is also the student membership consultant, and that is an appointed position, just like the chapter liaison is an appointed position. And both of those appointed positions are for 2 years, and they must be renewed. There's no time that they don't time out. Although, according to our bylaws, many of the board of directors individuals do time out in terms of years that they can serve on the board. For instance, if a person were to go from vice president to treasurer and then to president, they could still only serve 8 years. And the reason I say this is that it is important that you review the bylaws as often as you can. And we do have an extraordinary bylaws chairperson who's going to be reviewing all of the bylaws this year. So if there's anything that you see that needs to be adjusted, please just let Chair Jody Rogers know about that.
Thank you, Delanora. Those are great additions. And also another key point is those that are elected are voting members and those that are appointed are non-voting.
That's a very important part. To go along with that is If you're not a voting member, it doesn't mean that your opinion is void. We want to hear what you have to say. That's why you're there. So while your vote may not count, many times when we send out information and we ask you for your opinion, we want your opinion. Now, if we get down to a tie or something, well, I might have to pull out those votes, but I really we want to hear what your views are on the subject matter. You're important. You're very important.
Absolutely. Absolutely. Thank you. All right, next, so I alluded to board liaison positions just a little bit ago, and directors on the board, they also serve for a liaison for either a committee or a cabinet. So they will participate with that committee or cabinet and attend their meetings and serve as a resource and provide leadership guidance. And then they also participate in activities, but then that also brings forward back to the board. They provide those reports and, outline the committee activities, and it increases the communication in both ways. So they can share information from the board with that committee or cabinet, and then the board will be aware of the cabinet or committee activities. So it's really been a very beneficial way to improve that communication and support. Next, we have on here board retreats. Those are in June and December. And those are a wonderful opportunity where we get together and network, and we work on the strategic plan and items that we're working on at the time. And also great opportunity again for professional development. So definitely those will be June and December. And I don't know that we have those dates set yet. Do we, Delanor?
They are on my board in my office. I'm just not there.
Okay.
So yes,
okay, but just know June and December.
Yeah, I think I know that the board retreat for the fall is November 30th.
Okay.
And I'm thinking June 27th is what I have for the June meeting. And we'll have our same facilitator that we had this last year, Vivian Blade, to be our facilitator. So I'm very excited about that.
Yes. She's amazing to work with. She is. And then also for the December time, or, it's at the end of November there too, there's also the leadership retreat. So we have the board retreat that is board members in June and December, but then also right there at that December timeframe is a leadership retreat with everybody that is a leader in KNA and active is encouraged to attend. And again, it's professional development and how can we move things forward. The Legislative and Leadership Academy, this is our first year that has been planned. Well, it's been planned for a long time, but implemented, and it has been such a huge success. I am participating in that. There are 18 fellows, and we got to participate in 3 weeks of leadership content and 3 weeks of legislative content that was reviewed by a variety of speakers and facilitators, and every single moment of it was excellent. So I've told people, regardless of how much experience you have, either in the legislative process or leadership, some of it is an excellent review and things maybe you didn't think about it in a while, but you always pick up something new. I mean, truly, they have been phenomenal. So I encourage it next go around that you apply for these. Another aspect of that is that everyone will have the opportunity to either shadow a nurse leader in Kentucky, or a legislator. So, for example, I chose to follow a legislator, and I will have the opportunity to spend the day with Senator Steve Meredith, and that's actually coming up in February. And I sent him an email to confirm when and where to meet, and he replied back so quickly. He's so excited that we're going to be doing this with him, and he's actually doing it multiple days. He's going to have several of us. But my day, he's already outlined the agenda, when and where to meet, the meetings that he has, the committees that he's attended, the caucus. I mean, it's just going to be a phenomenal experience for me to spend that time with him. So again, everybody will have different shadowing experience, but that is it. And then also everyone will participate in a project of some kind. And their project will, of course, promote nursing in the KNA and what can we do to, promote our strategic plan. So right now we have 18 individuals working on another fabulous project to help the nursing profession in Kentucky. So more to come on everybody's projects. So everybody's in different stages of it. My project I'll talk about in a little bit later. It's the legislator engagement program. Next is the learning management system, or on-demand CEs. It's through the website. It's a portal. And there is a variety of educational offerings on there that you can utilize on a routine basis. And there are a couple that are free, and we'll talk about one of those a little bit later, but they're nominal fees and great opportunity to have a CE. And I'm sorry, Dylan, I can't remember the number,
71.
71. There are 71 different CE opportunities that you can utilize. So great resource there. And then if you attended or paid for and were not able to attend all of the concepts and sessions for the conference, you have until February 6th, I believe it is. Yes, coming up. So you can still get on the LMS. You do not have to pay because you've already paid, and watch what you were not able to watch and still get your CEs for that. So don't forget that deadline is upcoming.
Yeah, I have two things on that. And this is something I just found out this morning.
Oh,
Fresh, hot off the press. And that is every member has an account on our learning management system. And all they need to do is to go to the learning management system and reset their password, because many of them don't remember what their password was. So that is totally awesome. So they don't have to make an account. So that's just really cool. The other thing about the learning management system is it's available 7 days a week, 24 hours a day, which means that there's no time that you can't get a CE if you want to, or you want to learn something new and exciting. Our learning management system is pretty awesome, as a matter of fact. Yeah.
And it has the 2 mandatory CEs on it too. So if you've not had the opportunity to do those, we know some people got them done quickly last year, but some, depending on your priorities and your to-do list, you may have had to wait on it. You do know they're due in July. So make sure that you get those completed if you've not done them yet. They're phenomenal. Absolutely excellent.
Kim, was there anything on that learning management system that you wanted to share? Since you're the learning management system queen.
I don't know about that, but but on the mandatory CE side, I would like to encourage everyone to encourage all of their nursing friends and colleagues to not wait until July 1st, please, because we do not want the system to crash on June the 30th. So please get your mandatory CEs done here in the next few months. If you have not done them already, encourage all your nursing friends and colleagues to do the same. And that it is just $5 if they are not KNA members and have not seen this, although they should have. It is just $5 for the mandatory CEs. And while they're there, there are also 2 free CE opportunities. So they can earn, I believe, 2 additional one CE each for building the nursing profession through their professional nursing organization. So for all your non-member friends, encourage them to watch that. And Rural Farm Stress by our own Dr. Paul Narad is also free if they need some CEs as well. And then there are 68 others, I think, for you to take a look at. So we appreciate it.
Absolutely. Thanks, Kim. Okay, so a little bit about the home office. And I like calling it the home office, although I have a home office too. But it is the KNA home office. And I want you to know that I know who I work for. I work for you. And you are my bosses, and you direct me to get things done. On the other hand, and part of that is because you're responsible for governance. The boards are responsible for making decisions and governance. I am responsible for operations, and that means making sure that you have the tools to get things done. So say, for instance, you would like to have a Zoom meeting scheduled. You contact me, I'll make sure it gets scheduled. Say, for instance, you have minutes that need to be transcribed because, God forbid, poor Dee Dee has to work and she can't get those minutes transcribed. So she might say, Delnor, can you help me out here? I can help her out. And then questions. If you have questions about anything related to KNA, ANA, KNAC, KNF, Delnor, I can help you out. And for projects, right now, I think Dolores mentioned that the fellows all have projects that they are working on, and all of the projects have to do with something that will benefit KNA or something that will benefit leaders, or all nurses are leaders. So many of them needed some help on what project would help KNA the most. I had the answer. Most definitely, I had the answer. So, and doodle polls, if you need to try to pull together a meeting and you've got, 10 people and my goodness, they're like, it's like herding cats. We'll do a doodle poll for you, but contact me so that I can assign it to one of our team members, because one of the things that happens is if you call a team member and you ask them to do something, they want to help you. But I may have assigned them 12 other things already, and they don't know what to do. So don't put them in that quandary. Let me put them in the quandary and let me help you. I know who I work for, without a doubt. Also, I want to talk a little bit about the communication. We have a very active website. And the one thing I want to say about our website is use the search bar. If there's something you need to find and you can't find it, use the search bar. It's really good and very fast. The contact directory, that is something that Dolores just talked about. We send that out usually once a year, right after the leadership meeting, but we are constantly updating it. So what that means is if your email address changes and you are a KNA member, please let ANA know we can't change your email address. One of the things that ANA does for us is they collect our money and they give us half, and they manage all of our data, and we actually pay them to do that. So we can't manage your data. ANA manages your data, and they make sure we have that data so that we can do our jobs. We put out an e-news monthly that goes just to members. We also put out a Kentucky Nurse quarterly that goes to members and other nurses in the state and all the board members, whether they're nurses or not. Isn't that right, Robert? And then we have our special bulletin, which goes out monthly. So basically, if you're a member, you'll get an e-news and a special bulletin or a Kentucky Nurse every month. Okay, I want you to know that our open rate for our digital publications is 55%. And from what I understand from other digital publications, that's unheard of. So we're doing something right. We have Facebook, Twitter, Instagram, LinkedIn, and KNA 365. So we have ways to communicate with people. Now, I know that people say, well, it's just too much. It's just too much. Well, in my marketing classes, they say 7 times. You might reach them if you do it 7 times. I think we have 8. But I also want to mention that we do some advertising, like on television. I don't know how many of you have seen our KET ad that talks about the mandatory CEs, but it's quite good. The first time I saw it, it gave me chills. It was like, everybody knows about the Nurses Association. This is just wonderful. So if you haven't seen it, go to KET, and around any medical show or around the 7 o'clock PBS News Hour, you can see the Kentucky Nurses Association. Last but not least, I would like to ask you that if you do not have KNA 365, to please get out your phone and let's get you to have KNA 365. Now, let me tell you why that's so important. KNA 365 is a secure app, which means we can send secure information on that app, which includes your passwords to your portals. So go to the App Store, search for KNA 365, no spaces, select KNA 365, put in your email address, enjoy KNA 365. And when we send out something special, it will ding. So if you let it ding, so that you know that you need to check your app for something wonderful. Also would like to remind you all in terms of the website. We have members only resources, and we have members resources. We have a Talkify calendar. So if your organization, another organization that you're working with, or even in KNA, if it's a committee meeting or if it's a committee activity, you can put it on Talkify and we will approve it. It's a community calendar. The only thing we don't approve of is we don't do any porno, we don't do anything lewd, but pretty much everything else is, as long as it's education or an event that other people can enjoy or participate in, we approve it on Talkify. And it's really easy. All you have to do is go to the website, click on, I think it's right, well, that's Facebook, but it's right behind this column right here, and you can see that's where you put the information for Talkify.
So next is the KNA strategic plan. And, you know, everything that we do links to one of these 5 or multiple of these 5 focus areas. And just to refresh you, we have them on here. There's membership, practice development, education, research, and leadership, advocacy and health policy, financial sustainability, and voice and visibility. And what we've done most recently at our December board retreat is, as we always do, we discuss our strategic plan and throughout the year evaluate where it is as well. And so Delanor talked about evaluation and the things that we've accomplished with all of those. But then something that we did at that point is we broke everybody up into groups, and those different groups are now focus groups or task groups. And that way we can work on the strategic plan throughout the year and have it in the forefront of everything we do. And how can we promote these different focus areas? So the different task force groups are meeting throughout the year. And for example, I'm on financial sustainability. And so we are meeting, and how can we work to help promote the sustainability of our finances as the KNA? How can we bring funds in, non-dues revenue, boy, that's a tongue twister, non-dues revenues. And how can we, you know, continue to sustain the great work that the KNA is already doing? And then we will be reporting at the KNA board meeting when it's our turn. We're going through each of them this upcoming week. On February 3rd, this board meeting is going to be membership. And then the next month will be practice development. And then the month after that and so forth. So every month, one group will report on their meetings, their plans, their discussions. What can they bring forward to the board? Is there anything they need to bring to the board to be approved that can be moved forward? And so it's really exciting that the strategic plan is now a living document in everything that we do, instead of something we just look at twice a year. So much more will be coming with that throughout the year. And it's really great because it brings in that diversity of all of the boards, you know, all of our different backgrounds and perceptions and experiences and who we all network with. It's just phenomenal. I cannot wait to see where this goes from here.
And the results for all of the focus groups will be at our retreat in June. Yes. And so we'll be able to plan for the next year, because our strategic plan is a 2-year strategic plan. Mm-hmm. And one of the things that, I mean, I'm going to talk about it a little bit later, but it's a really weird thing to think about. Our fiscal year is July 1 through June 30. And so it gets so confusing when we start talking about the new year. Well, when we talk about the new year, we're talking about July 1. That's our new year. So it's going to be very exciting to get the full report at the retreat. I'm excited.
I am too. All of the work together of all 5 groups, that's fabulous. 23 legislative priorities. And you've probably heard these. And let me just tell you the process of how they are developed. The Governmental Affairs Cabinet, they research different concerns and issues that impact nursing in our state. And then they recommend legislative priorities to the KNA board. And then the KNA board either approves or disapproves them. And they, this year for 2023, approved these legislative priorities. One is workforce and workplace violence. And we have a couple of statistics here to share with you. So just to help you understand, I mean, we all hear about workplace violence, but just to hear these statistics, it really makes you understand how important it is. 48% of nurses report an increase in workplace violence. 63% of medical providers report injuries from violent attacks. Healthcare workers are 5 times more likely to experience workplace violence than any other industry. 39 states have enacted some forms of workplace violence prevention legislation, but sadly not Kentucky yet. But we are working, since this is one of our priorities, we are working actually with Representative Jason Nemes, and he and his staff that drafted this bill is drafting a workplace violence prevention for all healthcare providers, not just nursing. It's, you know, we collaborate. And that has already been filed, and we cannot wait to see where that goes. It is actually where healthcare organizations will need to assess their prevention strategies. They will need to implement a prevention plan, which includes education, including de-escalation to help prevent violence, increased reporting, because right now we know a lot of violence is not reported. So we want the staff to be able to feel confident and comfortable reporting, and then they'll receive the help they need at that time and after, as far as debriefing. And then also, then we can get some statistical data to really see in Kentucky what is the impact of workplace violence. So hopefully that will be a bill that will progress this legislative session. We also have workplace support, which of course is the working nursing shortage. And a couple of statistics here for you. Currently, 36% of nursing, there's a nursing shortfall in Kentucky. So we are 36% short from what we need. Nearly half, which is 47.5% nurses, are 50 or over. And over 1 million nurses nationwide are expected to retire between now and 2030. And, you know, that is just right around the corner. That is just 7 years away. And so we absolutely need to think, if we've already got a 36% shortfall right now, what's that going to be in just a few short years? So we need to combat this daily. And then another statistic is only 16% of currently practicing nurses live in rural areas. So that shortage is compounded in those areas. So along with the KNAC, as Delano mentioned, there's a lot of work and discussion and review of data. And of course, we're always looking for ways that we can help support and retain current nurses, as well as to increase that pipeline. And then the next priority is decriminalization of nurses. And that is where we are also working with Representative Jason Nemes on a bill to prevent decriminalization of nurses. And actually, we were just in another meeting, and Delano explained that bill so eloquently. I'm going to ask you to go ahead and just do that again. I can do it, but let's let Delano breathe. She had her breath. She can talk again.
Well, I think this is really important because we know that organizations have systems problems, but many times human error is what gets blamed for a problem, or say a medication error, when in reality the system that was supposed to support and prevent the medication error is not in place. And so this decriminalization of nurses is focusing on systemic issues that may lead to errors, whether they're medical errors or other areas. And then we want to make sure that nurses are not criminally prosecuted for human error. Extremely important. Now, this, of course, we hope that will transcend nurses, meaning that other healthcare providers, when they provide errors, they have errors. But we're focusing on decriminalization of nurses.
Absolutely. And to feel confident and comfortable and be in an environment where they can report those errors so that those processes can be changed.
That's extremely important, because if they make errors and they don't report it, then how do those systems get changed? Those errors will happen again and again.
Absolutely. Thank you. Okay, and then the 3 items for strongly support. And just to let you know a little bit about processes, if anybody has a concern or, you know, there's an issue with healthcare, you know, it's certainly nursing, but it's healthcare in general and our protecting our public and the population that we serve in the state of Kentucky, they can complete a form that is completed and they ask for support or opposition of whatever the issue may be. And then that goes to the GA cabinet. And again, they research it and they evaluate it. And then they make a recommendation to the board, just as they did with those legislative priorities. And then the board reviews that further. And then they will approve to either strongly support, or oppose, or strongly oppose, whatever the issue is. So this year, 3 items that we are continuing to strongly support is the school nurse initiative, which is the goal to have a school nurse in every school every day, all day. The SANE Nurse Initiative to increase some funding to have more SANE nurses available for those who need them. And then the restructuring of the CAPACS. So of course we can provide care and access everywhere, but particularly those rural areas that we just mentioned. So if we have nurse practitioners that can perform to the top of their practice, they can certainly provide that.
And I would like
You
to
wanna
make
add
it,
some?
yeah, I want to add something about the SANE nurses, because I'm looking at Robert's face and I'm thinking he's saying, are
What
nurses,
is it?
yeah, are nurses insane? No, Robert, nurses aren't insane. SANE nurses are sexual assault nurse examiners, and we only have 367 of them in the entire state to serve 4 million Kentuckians. So we need more education. There needs to be time off so that they can perform these duties for different organizations. And so that's what the SANE Nurse Initiative is, not insane nurse.
So we can have a nurse that is a SANE nurse be available for anyone in Kentucky that's victimized, and they can receive the highest quality of care and support. Mm-hmm.
And then on the restructuring of the Kappa CS, someone asked me, well, what exactly does that mean? Well, as Dolores said, it's really about access to care, so that when nurse practitioners can provide support to their highest education level, expertise, and ability, then there's more access for individuals to have healthcare. I like to talk about the money, because as the governing bodies, you're responsible for making sure that we have enough resources to do what needs to be done for the organization and for nurses in the state. So we do monthly reports, and our financials are looking very good at this time. They haven't always, but we have worked very hard to have stable finances. Isn't that right, Liz? We have insurance that we pay for our directors and officers. And that's another reason that it's important to understand where decisions are made, because they are insured. Should there be an issue and our directors and officers get sued, we have insurance to protect you. And then stewardship. Stewardship is something that came about 5 years ago as a way to help the nursing, the foundation, to raise money to give it away. And so it is an expectation that board members provide time, talent, and treasure to help the foundation support research, education, and scholarship. Taxes, we are exempt in that we do not pay taxes, although I was told that in January, we're going to have to start paying taxes on the amount that we pay our lobbyists. That's okay. But we don't pay taxes, but we do file a tax report every year, and it is for that fiscal year that I mentioned, and the boards are responsible for reviewing and signing off on them before I sign them, because that piece of the governance is your responsibility. Remember, I work for you. We already talked about the fiscal year budget development. We usually start that in February. So if there are things that you think we need more or less of, let me know so we can get started and getting that budget developed. And it has to be approved by the boards by June 30 of that year. So by June 30, 2022, the budget for July 1, 2023 to June 30, 2024 must be approved by the board in order for us to meet our bylaws responsibility. Non-dues revenue, well, we need a lot of that because dues do not cover our expenses. And so some of the things that we've been doing for non-dues revenue is, we have a store, an online store. We have the mandatory CE classes. We have the CE classes. The license plates will help us with that. The raffle that we just did for the KNF helps us with that. So non-dues revenue is extremely important if we are going to continue to move forward. And one of the things that we've done for non-dues revenue in the last 2 years is grants. Now, grants are great, but there is a lot of paperwork that goes with grants in terms of being able to quantify and qualify what we spent the money on. So I'm one of the reasons I'm bringing up grants is we've applied for another mega grant. Hopefully we will get it, but I may need more staff. And I'm just telling you that up front. If we get it, I'm going to need more staff. So non-dues revenue is extremely important to the success of the KNA, the KNF, and KNAC. Other successes that we've had, we have done tremendous work on social justice, diversity, equity, and inclusion. I just recently I thought it was going to be a one-page document. I think it turned out to be a 3-page document of all the work that we've done since 2020 on diversity, equity, and inclusion, including our op-ed that we did when George Floyd was killed and Breonna Taylor was killed and David McAtee was killed. And in that op-ed, we talked about our plan for how we as an organization were going to address social justice issues, diversity, equity, and inclusion. And included in that was a plan to do social justice movie nights. We've done 10 since we started. Implicit bias training, which we developed and put out into the Kentucky stratosphere. And we've had people from all over the country to take that implicit bias training. So far, I think our numbers 13,562, something like that, Kim. And then our CE approval program, which is going very well. And we don't make a lot of money, but it's a service that we provide for our members, and then prevention of nurse suicide. And we've had 13,609 people to take that. So we've been very successful related to bringing in some non-dues revenue and related to providing educations that will help to save lives. That was our premise when we made our proposal to the Kentucky Board of Nursing, that we needed these 2 mandatory classes. And so since I'm talking about the Kentucky Board of Nursing, in June of 2020, we provided June 2021, we provided a proposal to the Kentucky Board of Nursing to mandate these 2 classes, prevention of nurse suicide and implicit bias training. And we were told prior to that presentation that the board doesn't like to do mandatory classes, so don't even think you're going to get that passed. And so I said, okay, we're going to do it anyway. So we did our proposal, and unanimous. It was unanimous. They said these 2 programs will save lives. We have to do it. And so there were 2 comment periods, and then it went to the LRC. And then at the end of January 2022, we were ready to go. And so we developed these programs. And I have to tell you, it's been a labor of love for both of those programs. However, they were not free to develop. And I did use some of the KNA, KNAC money to get them developed. And again, that is why we have to charge the nominal fee of $5 a class, so that nurses know what to do to save lives. So now I'd like to talk briefly about our affiliates program. Soon, I'm going to be able to grow this program. We started the affiliates program right as COVID hit the world. And so we really haven't had much time to grow the program, but the affiliates program is designed to have nursing organizations, other healthcare organizations, people who care about nursing to come together around a table to talk about issues that impact nurses. We have 22 affiliates right now, and we do a tremendous amount of networking and support. They tell us what we can do to support them, and we tell them what they can do to support us, as well as 90,000 nurses in the state. We have our meeting every other month. Our next meeting is December. Oh, I'm sorry. Oh my gosh. Our next meeting is February the 6th. And we'll be discussing all of the things that we're going to be doing in the very near future.
So I'm going to talk briefly about our KNA cabinets and committees. In the bylaws, there are detailed descriptions, but I'll just give you a little snippet of each of them. As Delano mentioned earlier, some are elected positions and some are appointed. And we'll just start here at the top. The Education and Research Cabinet It shall stimulate and promote the professional development of nurses and advance the profession of nursing. And they do that in a variety of different aspects. But one great thing that they recently have outlined is a process and policy where nurses and others can request assistance with research. So that's been a phenomenal process that's been outlined. And so that's a great accomplishment of theirs. The purpose of the Governmental Affairs Cabinet is to work for the improvement of healthcare standards, work for the availability of healthcare services, initiate and influence legislation, state and national health policy and governmental programs, and advance the profession of nursing. So we talked about that a little bit earlier as far as the legislative priorities and support or opposition of different issues or concerns. We could certainly do that. But a couple of great items that they've worked on and implemented and great accomplishment is the Legislative and Leadership Academy. And as I already talked about the program earlier, it is such a phenomenal accomplishment that they developed and implemented that. And it's just been great. They oversee Nurses Day at the Capitol. They plan that and implement that as well. And this year, in addition to that, they are planning the legislative conference in May. And so we have that coming up on a slide as well. And then the Professional Nursing Practice and Advocacy Cabinet, they shall foster high standards of nursing practice and advancement of the profession of nursing, promote awareness and understanding of current nursing policy and workforce and workplace issues, and involve nursing in strategic and professional address in those issues. So this cabinet is responsible for the wonderful social justice movie nights that Delano mentioned. Truly, they've been phenomenal. And, you know, such a bigger success than was initially planned. They, you know, people from across the country, including the ANA president, Dr. Grant, has attended these. And he has mentioned them. I've heard him on multiple occasions mention them at ANA gatherings. So it's pretty phenomenal. And then initially, you know, they wondered about the cost of the videos, but then they ended up making quite a bit of money. So when you talk about those non-dues revenue, this ended up being a surprise for that. So wonderful opportunity to increase awareness for social justice, but also promote KNA. The bylaws, they prepare and proposed amendments to the bylaws, and then those are reviewed and approved by the KNA board, but then they have to go forward to the general membership approval in October at our annual meeting. And then next we have events planning and programming. And their primary purpose is the annual conference. They do plan that every year, but they also are involved with the annual business meeting and other events as directed. So that they do a phenomenal job with that. Ethics and human rights, it's the dissemination of the code of ethics for nurses, provide education programs and forums for discussion, and serve as a resource. I have seen them hold forums to discuss information. They've provided informational videos that they've put out on social media. And of course, as Delano mentioned earlier, they've been handing out the gray ANA bookmark that has the code of ethics on it. So they do that with graduates, but I also believe that they've done that in clinical settings. And I think it was mentioned at a hospital recently that they did that. So again, just everyone is doing just amazing work. It's so great to talk about what they do. The Finance Committee, they review the monthly income and disbursements of funds, prepare the annual budget, advise the board of directors regarding the income, investment, and expenditures of funds. Membership Recruitment and Retention Committee, they promote professional interest in membership in the KNA. So they collaborate, brainstorm, and implement ideas to recruit and retain members. And something that they started last year doing is about quarterly bringing in CNOs from different area healthcare organizations to collaborate with them. We have a meeting coming up, I believe we're planning for March to continue with that. So they also oversee the membership challenge to help increase recruitment of new members. So great work there too. The Nominations and Elections Committee, they of course work on the election, and they request names of candidates, they recruit candidates, review the qualifications, prepare the ballot. They actively encourage members to vote during the election. So a lot of great work there. We actually have a slide in a minute on them as well. Policy, procedure, and resolutions. They review policies and procedures and ensure that they're consistent and congruent with the bylaws. They prepare new policies and procedures as indicated by the KNA board. And then they also review resolutions and monitor their progress. Now, with policies and procedures, those go forward to the board as a recommendation from this committee, and then the board does approve those. They do not need to go to the annual meeting for that. So just a brief little overview of those cabinets and committees.
And just to reiterate, there are 2 of those committees where all of the members are elected, and that is Ethics and Human Rights and Nominations and Elections. All of the others are appointed by the KNA board.
So the KNA election process, so again, the Nominations and Elections Committee oversees that process, and I just outlined that in the previous slide. But something that they did this past year, as they develop the ballot every year and work on the voting process, work together and collaborate, of course, with Delano, and found a software to help increase the user friendliness of voting. And it was decided to use Election Buddy, and it truly was. It was a little bit of a cost, but it was well worth the cost because it was a user friendly. There was a lot of feedback on that it was much easier to vote, and it actually increased our voter percentage. What was it, Delano? 19% of our members voted?
19.5.
See, even better, 19.5. So that was pretty phenomenal. So we'll continue getting started with that with the committee. They're getting ready to get started for this year's election. They work with the candidates and encourage them to do campaigning, and also hold a candidate forum, which is kind of a meet and greet. So all members are encouraged to attend, but particularly the candidates, and they can do a little bit of a campaign statement and explain why they are the best person for that position. And speaking of the ballot, the Nominations and Elections Committee works really hard to have a fabulous ballot of amazing KNA members. And we really want to try to have 2 candidates for each position. So that way, when you're voting, you can choose between 2 phenomenal people and we'll win either way it goes. So definite work there.
I was just going to add one thing that the committee has done in the past 2 years, is that is intentional focus on diversity.
Oh, yes.
And inclusivity. And that included geographically as well as gender, age. I mean, they really, and they kept statistics.
Yes.
And so we know where we have, where we're starting as our base, and we can only go up, but they did a phenomenal job.
They really did.
Yeah.
They improved the biographic form, so we get that information starting out. So absolutely. So a diverse ballot, that helps diversify our active members. So that's very good. And then, of course, in August, that's when we vote. So, that'll be forthcoming. You'll get more information on that. This slide here, we pretty much already talked about the legislative process, as far as the issues, support and not support, and our legislative priorities. But also just want to make sure you've marked your calendar. If you've not already, Nurses Day at the Capitol is going to be March 1st. It is going to be a phenomenal day of networking with each other from nurses all across the state, professional development, and advocacy. We will be able to hear from legislators and be able to speak with them, and of course, share our knowledge and expertise and what we think should go forward. So definitely try to be there. We are so excited that we have the House chambers reserved as well as the rotundum. So it really does promise to be a great day. And then we also want to share, if you're not aware, Julie Denton is our new lobbyist. Sheila did retire last year, and Julie just put on her boots and started running. She has been an amazing resource for us and providing just so much information. She has a background as a legislator and of course has been a lobbyist for some time. She is keeping the GA cabinet up to date and monitoring bills and talking to legislators. She's been instrumental in the 2 bills that we collaborated with Representative Nemes. So she's a great addition to the team. Next is the project I mentioned to you all earlier, the Nurse Legislator Engagement Program. And this is something that we're working on to help, of course, leverage the voice of nursing in Kentucky, which is something that we're always doing to represent our 90,000 nurses. And what we're doing is pairing KNA nurse members with a legislator. And Delano and I was at an ANA event in Washington, D.C. in December, and They have, one of the other states said that they have a program very similar to this, where they've paired 100 of their nurses with 100 of their legislators. Well, and Delano and I started talking about it, and it's like, 100 is absolutely awesome, but we're going to set the goal for all 136. Truly 138, but we have 2 empty seats right now. So we will get those other 2 when they get filled. But we're right on the road to make that happen, and you all are making that happen. So we have sent out, there's been publication about it, so hopefully you've seen it, to register and sign up for the training, which is next month. And we're going to go over the legislative process and how to build a relationship with your legislator. And we're starting at the state level. So we're pairing everyone with either their state senator or their state House representative. And then once you build that relationship, then you can serve as a resource and, again, share your knowledge and expertise. And the KNA is a fountain of information with resources. So anytime you need anything, you just need to Delano know, and she'll make sure you have the statistics and the information. I mean, it's just amazing. Anytime I ask for anything, here you go. So it is. So moving forward, we'll pair you and we'll provide you with information as the bills move forward, or any issues with KNA, anything we're strongly supporting, we'll give you information to share with them. But we wanted to get where you have that relationship, and then your legislator is going to come to you because you're going to be that resource for them for nursing and healthcare. So we are really excited to see where this is going to go. So far, we have 120 signed up. So, we're almost there. We will get there and get them all. But again, we're starting with state, and then we'll move to our federal legislators as well later on. But
and I just wanted to say that this is a members only benefit.
Mm-hmm.
If you're not a member of KNA and you would like to participate in this, you need to become a member, unless you can't. So some of our board members are not nurses, so they cannot become a member of KNA unless they do the friend route. But if you want to attend, I will make that happen because I work for you. So just let me know, and we will definitely make this happen. We've identified 8 people who thought they were members, who were not members, who wanted to attend this, that couldn't attend because they didn't show up on the membership rolls. They are now members.
So it's a recruiting process too.
Absolutely.
Pretty awesome. All right, we mentioned the legislative conference that the Governmental Affairs Cabinet is planning, and the tentative date right now, we're looking at May 26th. So hopefully that will line up. We'll bring out more information later. But again, it's going to build on the Nurses Day at the Capitol. It's going to have a lot of great professional development and advocacy work, and where we can go from here. Next, just a couple reminders, and this is one of my favorite quotes. So hopefully you all have seen that as well, because we absolutely can be the change in the world. But just a reminder of these dates. So mark your calendar if you haven't already. July is when the Nurses Plate is now due. It was March, but it's been postponed. Nurses Day at the Capitol is March 1st. Tentatively, the legislative conference is May 26th. Nurses Month is May. Lots of great information coming forward then soon for that month. The board retreat will be in June, and then December. And then again, there are so many CE opportunities and other events throughout the year. Next, Kim mentioned this earlier. This is one of our free CE offerings for you as well as colleagues. So please encourage and share. Anybody, can get on the LMS and watch this and obtain the 1 CE for it. It's building the nursing profession through professional nursing organizations. And it is Delano, Donna Metter, our immediate past president, Ann Sahingas, our chapter liaison, and I. We go over the process of the importance of professional nursing organizations, with, of course, the KNA as the forefront, because, we represent all 90,000 nurses. They're all important, but, we're a little biased. And also, the difference between the KNA and the KDN, and just a great fountain of information. So if you've not had the opportunity to take the CE, we encourage you to highly do that. You'll get a lot of great background information.
It is also available on YouTube. You cannot get a CE if you watch it on YouTube. For the non-nurses, if they would like to go to YouTube and take it, it's definitely worth the 50 minutes. It is worth your time. Not because I'm in it, but because it's
it is good. It is. We've had others tell us that. All right. This is just a little collage of some of the support that the KNA has done early on in the pandemic, right? When there was not PPE, the KNA worked to help get face shields. When there was not hand sanitizer, the KNA worked to get sanitizer for nurses. We put apricot ribbons and signs thanking nurses all across the state. So the KNA works hard to support our members and all 90,000 nurses in Kentucky. And we thank you guys for attending today and all you do and for your service to the KNA and again, to Kentucky's 90,000 nurses. So before we end with a wonderful video, did this generate any questions? Does anyone have any questions or comments or anything that we can help you with? All right, well, this short video, we want to leave you with a little bit of inspiration. And some of you may have seen this, but I could watch it every day and still get chills from it. You know, it's inspiration for the nursing profession. And again, thank you for being here today and for serving the state's only professional nursing organization that represents the entire 90,000 nurses in Kentucky.
Twice about the sacrifice. Here's to the extra mile that you take it to. Yeah, here's to the frontline warriors, to being brave for all of us. You didn't have to make him laugh or hold her hand like that. You didn't have to love, but you did, just to make them all feel better, yeah. You didn't have to pray all night. You didn't have to risk your life. If everybody loved like you did, the world would be a whole lot better. You didn't have to. No, you didn't have to. No, no.
You give it all like there ain't much to it. Fire's all around and you walk right through it. I hope you know we're all thanking God for you. Yeah, there's not enough words to say. You're a hero in every way. So I raise my glass for everything that you do.
Yeah, here's to the frontline warriors, to being brave for all of us. You didn't have to make him laugh or hold her hand like that. You didn't have to love, but you did, just to make them all feel better, yeah. You didn't have to pray all night. You didn't have to risk your life. If everybody loved like you did, the world would be a whole lot better. You didn't have to. No, you didn't have to. No, no. Thank you, 'cause you didn't have to. Thank you, 'cause you didn't have to. Here's to the frontline warriors, to being brave for all of us.
Now, the important thing about this is that it's a great video, but the cover was made by Jody Rogers' son. And more than 1/3 of those pictures are nurses from Kentucky. And this was done by Nurses Everywhere. And Nurses Everywhere, people all over the United States donated money to make this video. So
Pretty awesome. It truly is inspiring. And thank you guys for understanding the difficulties.
really.
We got it. All right.
So I can send out this presentation to everyone. If you want it, just let me know. All right, we'll do it. Thanks, guys.
Thank you, everybody. Bye.